Hello, good morning, good afternoon, good evening, wherever you are watching me from. Today is the 20th of January, 2024. All right, I say good morning to everybody. Today is January 20th, 2024. All right, we'll be discussing juvenile diabetics. Today, I will be discussing juvenile diabetes, kids, and type 1 diabetes. That is today's topic. We'll be discussing type 1 diabetics in kids. Another name for type 1 diabetes is juvenile diabetes. All right, so today we're going to dive down into what is juvenile diabetes. There are a lot of parents, a lot of families that are going through uh, difficulties having a child that is having this chronic illness, but they don't know or they are not equipped with the required information on how to take care of this chronic illness. It is very difficult as a parent if your child is passing through this illness and you don't have the knowledge on how to provide him or her the necessary care that he or she deserves to handle this diabetes issue. So, as a parent, the most important thing, if you have a child that cannot verbalize, what I mean cannot verbalize, he or she is too young, is a teenager, very, very young, and cannot talk. There's no way he or she can express the pain, the symptoms he or she is getting. So they cannot verbalize, they are too young, they can't talk, and they are having this illness, juvenile diabetes, type 1 diabetes. So it is very, very difficult as a parent if you have a child that has type 1 diabetes and you are not equipped with the knowledge on how to provide the necessary care for that child. It is important as a parent, as a caregiver, for yourself to be equipped with the knowledge of diabetics, then you'll be able to provide the necessary knowledge and care to that child. All right. So um, today we'll be talking about it. I'm going to give you guys all the tips, all the necessary information that you need to take care of your child. So we're going to just wait a little bit for everybody to join the program, and then we can kick it up. So let's. I'm going to wait for a little bit. Let everybody join the program, and then we can now start holding. Please, if you are joining me now, kindly indicate where you're watching from. We're just waiting for everybody to come online, and then we can start the program. Because of the time difference, a lot of people indicated interest. They are available to watch the program. So, all right. So, just give a few minutes. I want everybody to come online, and then we can now start fully on the program. Okay. Um, how are you guys? Please indicate where you are watching from, please. I'm I'm waiting for everybody to come online. All right. So I'm trying to wait for. Uh, I'm going to give about 5 minutes to get prepared, and then we can now start. Okay. I'm waiting for 5 minutes, and then we can now start the program. Let's see how many people to join the program, and then we can now start. Waiting for everybody to join, and then I can now start the program. Let's see. I'm just gonna give everybody 5 more minutes, and then okay. So let's start now. All right. So the program is gonna go ahead now and start. So those that are gonna join later, then they can join later. So we are going to talk about diabetes in children. Why do children with diabetes? Uh, why do we have children with diabetes, type 1 diabetes? Okay. Why do children have type 1 diabetes? Or why do children as early as 6 months to up to a year already have diabetes? Diabetes in children can occur at any time. Okay. Diabetes in children can occur at any time. The title of this video we are doing today, or this program, is Juvenile Diabetics, Kids and Type 1 Diabetics. That is the title of today's program. We're going to be discussing more about diabetes in children, type 1 diabetes in children. From the previous videos that I've done in the past, I told you guys another name for type 1 diabetes is called juvenile diabetics, because uh, this type of diabetes is mainly found in children. Okay, it is mainly found in children. I would say about 80 to 90% of type 1 diabetes are mainly found in children. It then, at a later stage in life, you find them in adult type 1 diabetes. Okay, so juvenile diabetes or type 1 diabetes can develop at any stage in children. Okay, Juvenile diabetes can develop at any stage in children, but the majority of the newly diagnosed cases still developing during the childhood. You can see a child 6 months up to a year already have type 1 diabetes. Okay? So even children that is less than 1 year have type 1 diabetes. The younger the child, the more difficult it is to understand their symptoms. Okay? The younger the child, for instance, a newly born, a child that is 6 months old or 1 year old cannot verbalize, cannot talk. Okay? So as a parent, you find it very difficult to understand the symptoms that child is exhibiting. So the younger the child, the more younger the child, it is very difficult as a parent, okay, to understand their symptoms simply because they cannot verbalize to you. That means they cannot talk to you. So, first of all, you have to understand those symptoms as a parent that has a child with type 1 diabetes, or how to spot the symptoms of type 1 diabetes in children. So if you're a parent, a caregiver, and you have a teenager at home, there are certain things you have to look out for. There are symptoms you have to look out for to understand if that child is passing through a health issues, and then you can take them to the doctor to find out what is the issue all about. So first of all, uh, you have to understand the symptoms. You be able to identify those symptoms first. Then once you identify those symptoms, then you can move on from there to the next stage. So um, so that is what we are going to do now is understand those symptoms. Understanding the symptoms is very, very important. Once you understand those symptoms, is very, very important. First of all, you have to understand what is juvenile diabetes or type 1 diabetes. Okay? Type 1 diabetes is formerly, before it was called juvenile diabetes, before they changed it to type 1 diabetes. So we have all kinds of type of diabetes. We have the type 1 diabetes, and we have the type 2 diabetes. We have the gestational diabetes and we have the pre-diabetes. But the most commonly two diabetes that they know is the type 1 diabetes and the type 2 diabetes. So previously, the name type 1 diabetes is called juvenile diabetes before they change it to type 1 diabetes. So it is believed that this type of diabetes only develop in childhood. Okay. So type 1 diabetes is an autoimmune disease. Okay. It's an autoimmune disease. Okay. Autoimmune disease are conditions in which the immune system mistakenly damages the healthy cells in the body. Okay, it includes, for example, you have rheumatoid arthritis, you have the Crohn's disease, and some thyroid conditions. So these are autoimmune disease. So understand that. Um, so type 1 diabetics, okay, type 1 diabetics is an autoimmune disease. And what is autoimmune disease? Autoimmune disease is a condition in which the immune system mistakenly attack and damage its own healthy cells in the body. An example include rheumatoid arthritis, which as a result of inflammations of the nerves, okay, Crohn's disease, and some thyroid conditions. That is what is called, okay, autoimmune disease. And I said type 1 diabetes has to do with production, making of insulin. Okay, so you guys have to understand that. So, type 1 diabetes is an autoimmune disease. Um, there's, So the definition of autoimmune disease are condition in which the immune system mistakenly damages the healthy cells in your body. Types include rheumatoid arthritis, coronary disease, and some thyroid conditions. That is what is referred as autoimmune disease. And that is what type 1 is. It's a juvenile diabetes, formerly is type 1 diabetes, formerly known as juvenile diabetes. Okay, and it's an autoimmune disease. It has to do with production of the insulin or making of the insulin. Okay, so this means that your body immune system begins to attack itself. More specifically, your immune system attack and destroy the beta cells that produces the beta cells produced by your pancreas. That is what uh, type 1 diabetes is. Okay. Now, the beta cells are responsible for producing the insulin. I want to just give you guys what type 1 diabetes is all about. The beta cells are responsible. And remember, the beta cells are located in the pancreas. They are responsible for producing the insulin. Long after diabetes is diagnosed, the pancreas still continues to produce the beta cells, but the immune system continues to attack and destroy those beta cells. Okay, and that is why it cannot regulate the sugar levels. Now, without insulin, your body cannot make use of glucose, which is sugar in your bloodstream, as your blood sugar levels rises and less insulin are made available, because that is what type 1 is doing. It does not produce enough insulin that the body needs to regulate the sugar level. Okay, so without insulin, your body cannot make use of glucose, which is sugar, in your bloodstreams. As your blood sugar levels rises, less and less insulin is made available, and a number of once your sugar level keep rising, a number of serious and life-threatening issues develop. That is what is called type 1 or juvenile diabetes. Now, what are those life-threatening issues? Okay, what are those life-threatening issues? What are they? Okay, what are the life-threatening issues? Now, if once your sugar level keep rising, and then your pancreas is producing less insulin that your body requires, now there are some life-threatening issues that develops in your body. One, the toxic level of ketones are formed. Toxic levels of ketones are formed when your body is forced to burn body fat for fuel because it cannot make use of the sugar in your bloodstream without adequate insulin. This is how your body functions. So your body is not producing enough insulin. Okay, so I'm just taking you through what the child is going through. Your body is not producing enough insulin because your body mistakenly attack itself and destroy the beta cells, even though the pancreas is producing more beta cells that produces the insulin. It attack itself and destroy the beta cells. Now, once it destroys the beta cells, there's a rise in your blood sugar level constantly. And due to those rise of blood sugar levels constantly in your body, there are some life-threatening issues that develop. One, toxic levels of ketones are formed when your body when your body is forced to burn the body fat for fuel because it cannot make use of the sugar in your bloodstream without the adequate insulin. Okay. Now, the second one is the nerve ending in your fingers, toes, eyes, and other vital organs are gradually damaged or destroyed by the excessive amount of sugar present in your bloodstream. That is where you start having nerve damages. Once you have constant and persistent sugar levels, now your nerve endings in your fingers, in your feet, in your toes, and other vital organs are gradually being damaged or destroyed over a longer period of time because there is excessive amount of sugar levels in your bloodstream. Okay. Now, thirdly, your body begins to crave for more. Your body begins to crave for more sugar because despite the excessive amount of sugar in your bloodstream, your body cannot absorb it without adequate insulin. Despite you have high level of sugar in your bloodstream, your body keep craving for more sugar because the one that is in your bloodstream, your body cannot absorb because the inadequate insulin in your system. Okay. Now, The fourth one is that left untreated for too long, in a few weeks or a couple of months, severe high blood sugar levels and toxic keystone can lead to seizure, stroke, organ failure, and even death. So these are the levels of destruction of persistent high sugar level in your blood, and that is what the child is going through when he or she cannot verbalize or talk or communicate with you and say, "Look, I'm feeling my body is feeling somehow." So you have to get hold of what type 1 juvenile diabetes is all about. Once you understand what it's all about, how it is called, what causes it, or how it is started, and what are the consequences of persistent high sugar level in your bloodstreams, then you should be able to identify what the symptoms are. And that's what I'm going to go to next now for you to tell you guys what are the symptoms. Okay. Um, Now, so when your child is diagnosed with type 1 diabetes, family and daily routines may seem more complicated in the beginning, and over time, the support of your diabetes team, this will change. Okay, that will change. All right. So now, so when your child is diagnosed with type 1 diabetes, family life and daily routine may seem more complicated. And in the beginning, over time, and with the support of your diabetes team, this will change. Know that your child can have a healthy and fulfilling life with diabetes. Once you understand that, know that your child can have a healthy and fulfilling life with diabetes. Okay? As a parent, it is very difficult. It is very, very difficult to understand what symptoms your child is exhibiting because he or she cannot verbalize, he cannot talk. So it's left for you as a parent or as a caregiver to monitor your child, all the time in terms of the temperature, what he or she eat, or when he or she start rejecting food, or when he or she keep crying all the time. These are some of the ways they send information or they send message to the parent that something is wrong with me. When the child starts rejecting food, or is not eating properly, or crying all the time, or the temperature rises, okay, or the body's skin coloration changes, these are some of the things you have to look. Or when there's unexpected rashes all over the body, these are some of the things you have to monitor very well. But these are not the symptoms of type 1 diabetes in children. But I'm just giving you guys an overall view of how a parent monitor their child because the child cannot verbalize, they cannot talk. Except they start crying persistently for you to know something is wrong, or they start rejecting food. So know that your child can have a healthy and fulfilling life with diabetes. But at the beginning, it is very, very difficult. Okay? So caring for a child with type 1 diabetes, okay? Managing type 1 diabetes may seem overwhelming in the beginning. Your diabetics team, when we talk about diabetics team, it could be you, your husband, your aunt, your mom, or your other siblings or your other children. These are your diabetics team, including your doctor, will help you learn more about diabetes. That is why I said, if you have a child that is diabetic, okay, one, you have to understand the child at a younger age cannot verbalize, they cannot talk. Okay, it is very difficult at the beginning, but you as a parent, you must learn, you must get some knowledge about diabetes in order to give proper care to that child. And lacking the knowledge of diabetes, you're going to find it very difficult in managing that situation of diabetes of your child going through it. So it is important to equip yourself as a caregiver, as a parent, knowledge about diabetes so that you're able to provide the necessary care he or she needs. So managing type 1 diabetes may seem overwhelming in the beginning, always overwhelming in the beginning if you don't have any knowledge or clue about diabetes. Okay? Your diabetes team will help you to learn more about diabetics and feel more confident. It is important that you become comfortable with caring for your child diabetes so that you can help your child become comfortable too. As a caregiver, okay, of a child with type 1 diabetes, you will need to help them with. Okay, as a caregiver of a child with type 1 diabetes, you need to help them with the following. Okay, you need to help them with All right. So, as a caregiver of a child with type 1 diabetes, all right, you will need to help them with one, testing blood sugar, giving insulin, number two, number three, eating regular meals and snacks, and four, balancing food, medication, and physical activities. Five, recognizing the signs of low and high blood sugar levels. That is the responsibility of a caregiver or as a parent that has a child with type 1 diabetes. That is your core responsibility to be continuously testing for the blood sugar levels, giving insulin, okay, eating regular meals and snacks. We're going to go into it as we go down. We're going to go into it more. Balancing food and medication and physical activities, recognizing the signs of low and high blood sugar levels. Okay, this is the core responsibility of a caregiver that has a child with type 1 diabetes or a parent that has a child that has type 1 diabetes. Okay, now once you understand your role as a parent, that this is what I'm supposed to do, involving a child diabetes care is very important. Encourage your child. Involving a child in diabetes care is very important. Encourage your child if he or she can verbalize when they started talking. Encourage your child to be involved in their diabetes care right from the start. Identify reasonable tasks for your child, can do for themselves. Even younger children can do tasks such as choosing which finger, play with your child, tell them which finger to poke or to test or to take the numbers or read the numbers. Once you take the sugar levels, you tell them to read the numbers for you. As they become more independent, children can take on a larger role in the diabetes care with support from their caregiver or the parent. Okay? So diabetes, send them to diabetes camp. Okay? Involve them in a group. Let from the teenage, from when they are teenager, let them understand the health issue they are passing through. Let them understand that they are diabetics and these are certain things they're supposed to do. So talking to your child about diabetes is very, very important. Okay, the way you talk to your child about diabetes will have a big impact on how they perceive their diabetes and themselves. Being positive and supportive will help boost your child diabetes management. Okay, so once you understand that it is important to involve them right from the beginning, then you understand that um, it's going to be easy at a later on stage. As they grow older, you understand right from because you already been educating them from childhood to the adolescent age to when they become a full adult. Okay, so you have to get them involved when they start verbalizing, talking to you what diabetes is all about. Now, I have. I'm going to go to the symptoms. I'm going to go to the symptoms. Toxic levels. I'm trying to post this in. Left untreated. So without insulin, your body can not make use of glucose in the bloodstream. As your blood sugar level rise, and with less and less insulin available, a number of serious and life-threatening issues develop. One, toxic level of ketones are formed when your body is forced to burn body fat for the fuel because it cannot make use of the sugar levels in your bloodstream without adequate insulin. Two, nerve ending in your fingers, toes, eyes, and other vital organs are gradually damaged or destroyed. Okay, so now let's talk about how you can spot um, let's talk how you can spot the signs and symptoms of type 1 diabetes in a child. This is where it's very important. Let's talk about how you can spot, okay, the symptoms of a child that has not started verbalizing, okay, a child that is not talking yet, he or she cannot communicate to the parent that I'm sick, that I'm feeling somehow. So how can you spot the signs or the symptoms of type 1 diabetes in children? Remember, as I said, the type 1 diabetes in children appear at any time, at any age. Normally, they is normally found in children. They can be found, a child that is less than 1 year old can have type 1 diabetes. So there's no specific age that is, it can appear at any time. All right. I've seen children that are 6 months old that have type 1 diabetes. And it's become very difficult as a parent how to provide the necessary care for that child for the rest of his life. So it is very important when you are in that situation now that you have a teenager at home that is going through this illness, you have to equip yourself with the knowledge about diabetes. And once you grab the whole knowledge about diabetes, it becomes very easy in you managing that situation of your child. So, but first of all, it is this. So you have to, spot those symptoms in the early age. So type 1 diabetes can appear first like a curious type of flu. It can appear at first like a curious type of flu. Your child healthcare team may suggest it is simply a virus and send them home to rest. So when you have a child, okay, I want you guys to listen very well, and he has type 1 diabetes, and you don't know that that child has type 1 diabetes because of the body temperature have risen, okay, he's vomiting or he's not eating properly, his body look pale, he's weak. The first, okay, the first symptom, it might appear like a flu, like he has a runny nose, okay. Then you take it to your doctor, and your doctor will suggest, oh, okay, you know what, it's simply a virus, and then go home and rest. But ignoring the symptoms and delaying diagnosis and proper treatment can be life-threatening. So that running nose, that flu might be something serious But some doctors will tell you, just an ordinary flu, ordinary virus, he or she is going to be okay. No, it is proper when a child at that age starts having something like a runny nose, a flu, temperature changes, do a proper blood test to find out what is that symptoms all about. Remember, doctors don't treat symptoms, they treat the causes. It's the cause they treat, not the symptoms. So you have to find out what is the cause of that flu at that first sight that child is going through. That all of a sudden he developed the flu-like symptoms. Okay, having persistent running nose. So when you go to your healthcare and you say, "Oh, just go discharge, you just go home, just ordinary virus," as a parent, you have to persist that proper diagnosis be taken. Do a blood work, do a blood test to find out why the cause of that flu-like symptoms. Okay. The first sign of type 1 diabetes in children of any age is usually a sharp increase in their thirst. I want you guys to listen very well. I'm now talking about spotting the signs. Spotting the signs. This is what I'm discussing now. Okay. I'm discussing spotting the signs and symptoms of type 1 diabetes in a child. Okay. As I said, type 1 diabetes can appear at any age. Okay. At first, like a curious flu-like symptom is going to develop, like a running nose in a child. So you're going to see a child develop like flu-like symptoms, or like he has a running nose, or like he has a catarrh. In Africa, we call it catarrh. Your child, then you take it to a doctor. The doctor says, "No, you know what? He's fine. Just ordinary catarrh, ordinary flu. Just take him cold. It's going to be fine." As a parent, don't ignore that simple symptoms of flu-like symptoms. You have every right to demand for proper diagnosis of why he or she is having that kind of symptoms. For instance, if a child is having a flu-like symptoms or a catarrh, when it is not harmattan, when it's not a harmattan season and he's having a catarrh, then something is odd, something is wrong. So it's not when just as a parent you demand that a proper diagnosis should be made to know why my child is having a flu-like symptoms. That is one. Because if you ignore that first sign, it's a life threatening because the child have a type 1 diabetes, but what you are seeing is kind of confusing. All of a sudden, he has the flu-like symptoms. All right. Now, but the first major sign of a child that has a type 1 diabetes, a juvenile diabetes, the first major sign of a child that has a type 1 diabetes, okay, is usually a sharp increase in their thirst and need to urinate. When you see your child is drinking a lot of water, all of a sudden drinking a lot of water and then urinating often, that is the first major sign for a child that has type 1 diabetes. I want you guys to take a note on that. Okay? Take a note on that. So the first sign of type 1 diabetes in children of any age is usually a sharp increase in their thirst. Okay, and need to urinate. When you see your child want to urinate often, all of a sudden you change the diaper now, you sweat it again. By the time you go step out and come back again, you wet the diaper again, or he wet the pants again. That is the early sign, or that is the one major symptoms of type 1 diabetes or juvenile diabetes in a child. And this generally starts when the blood sugar levels are persistently above 200 milligrams per deciliter. So when the sugar level has risen above 200 milligrams per deciliter, the child will be experiencing frequent urination at every minute or every second. So when you see a child that have a sharp increase in their thirst and need to urinate often, okay, then that is a sign that that child might have type 1 diabetes. Okay, and that usually occur when the blood sugar level have risen above 200 milligrams per deciliter. Okay, so you have to watch for that symptoms. When you have a child at home that develop the thirst to frequent urination, wet the bed, wet the pants, wet the diaper at every second. You change the diaper, and all of a sudden, by the time you go and come back, he has changed the diaper, then know something is wrong because that blood sugar level has risen above 200 milligrams per deciliter. Then that symptom start to occur. So this intense thirst and need to urinate happens when the sugar build up on the blood over 200 milligrams per deciliter and is then filtered out of the blood in the urine by the kidney. Okay, so without enough insulin in the body, the sugar in the blood goes into urine. So you have to be very careful. Without enough insulin in the body, the sugar in the blood then goes into the urine. That is why when they test your urine, they find a lot of sugar. Okay, so this they can test. There's so many ways they can test for type 1 diabetes, either through the urine, through the blood, but most doctors do both. So when there's not enough insulin in the body, okay, to control the sugar levels, the sugar in the blood then goes into the urine, which is why your body has less and less energy as the blood sugar continues to rise. Okay, so your child will feel, unquenchable thirst. Drinking a lot of water is another symptom. Okay, drinking a lot of water is another symptom. Unquenchable as the body continues to draw fluid from everywhere in the body, because now the child is urinating a lot of fluid is going out, so he needs to replenish those fluid back. So that is why he has unquenchable thirst. He's drinking a lot of water to replace those fluid that he's losing through urination. So the child will feel unquenchable thirst as the body continues to draw fluid from everywhere in the body. Okay, in order to pass the excessive amount of glucose being filtered by the kidney, because uh, your, a lot of fluid is going out. As the fluid is going out through urination, because they are filtering the sugar level in the bloodstream, you need to drink a lot of water to keep up, so that he cannot be dehydrated. Okay, so this can also mean that potty trained toddlers and children may start wetting their pants and their bed as they struggle to keep up with the intense need to urinate more often. Okay, so the two symptoms you've gotten now, or the three symptoms I give you, if you see a child that has flu-like symptoms, catarrh, when it is not a season for catarrh, that should give you a red flag that something is wrong. So that's when you have to demand for proper diagnosis. Why my child develop all of a sudden have a flu-like symptom, catarrh, when this is not a season for catarrh. Okay, now but the major symptoms how to spot a child that has type 1 diabetes, if you have a teenager that cannot verbalize, is when there's a sharp increase in the thirst and need to urinate more often. Frequent urination, excessive urination, and that occurs when the blood sugar level has risen above 200 milligrams per deciliter. And then accompanied with unquenchable thirst to drink a lot of water in order to replace the fluid that child is passing out. Because excess sugar is being filtered out through the kidney, so he needs to drink a lot of water to help filter all those sugar out of the system. So you have excessive urination, okay, a sharp increase in the thirst to urinate often, unquenchable thirst to drink a lot of water, flu-like symptoms in the early stage when there's no symptom, when it's not a flu time. So these are three symptoms I've just listened to you guys. This is how to spot signs and symptoms for a child with diabetes. Okay, these are things you have to look at. In adult, there are a lot of symptoms you can look at. Okay, in adult, there are a lot of symptoms. But in the child, these are the three key main symptoms how to spot a child that has type 1 diabetes. Now, your child may be present with several or other top symptoms of undiagnosed type 1 diabetes. There may be other symptoms. All right, there may be other symptoms. Um, I'm going to list. Uh, I'm going to list. Okay, let me put it here. So I'm going to list other symptoms. I'm going to list other symptoms. Uh, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay. So changes in vision. I'm trying to list them and then explain what loss. And then we can discuss them together. Intense hunger. Increased frequency. Changing vision. All right. So okay. So I'm still discussing how to spot the signs and symptoms of type 1 diabetes. That is what I'm discussing. And I've just pasted other symptoms. I've just pasted other symptoms that you can look after. But I've given you guys the three major symptoms you can spot on a child that has type 1 diabetes. And then other symptoms, okay, which is what I just listed here. Other symptoms are intense, and increase in need to urinate, okay. Number two is fatigue and lethargy. Okay. Number three is changes in vision, such as blurred vision. Number four, unexplained weight loss. Number five is intense hunger. Number six is increase in frequency to urine, wet diapers, or wetting the pants or the bed, despite being 40 trained. Then number seven is changes in vision, e.g., standing close to the television. The other one, eight, is persistent diaper rash or yeast infection. Number nine is fruit and soft smelling bread. Then persistent irritable, moody, or stress. When the child, sometimes when they are in the moody, bad mood or restless, they start crying. When you see a child crying, every slightest thing annoying him, a child that used to play, happy, smiling, laughing, all of a sudden becomes moody, crying all the time, being isolated all the time, shouting, destroying a lot of things, then these are some of the symptoms. When you see a child behaving that way, they cannot verbalize, they cannot talk. So the only way is to display by action for you to understand they are passing through. So when you see a child being moody, a child that used to play with others, he likes playing with you, he likes smiling, he likes laughing, all of a sudden become isolated, become moody, he doesn't want to talk to anybody, any slightest something being irritative, okay, or start destroying things or cry all the time. These are the symptoms you have to watch out for, that something is wrong. Why is my child all of a sudden become isolated and moody, stressed, restless? These are things. And when you see a child with such behavior, as a parent, as a caregiver, you have to take that person to the doctor and then find out why that change of mood. And then dry bowel movement or constipation is the last symptom. So these are the other symptoms that you can spot on a child that has type 1 diabetes. But I've given you guys the first three major symptoms. The first three major symptoms I've given you guys already that you must watch out if you have a child that has type 1 diabetes. Okay? So if you then the other symptoms is the additional symptoms that you also have to spot. Okay? So looking for these additional symptoms of type 1 intolerance or so increased frequency of inward weather. So these are, or a child, when the child wet the bed all the time, persistent wetting the bed, have a diaper rash or yeast infection, changes in vision. These are some of the additional symptoms that you have to look at for a child that has type 1 diabetes. All right. So we're still discussing Now, I'm going to jump to where is the normal blood sugar level testing for that. Okay. So if you suspect, okay, if you let's so we've finished this now. So let's go to the next topic. Uh, let's first of all discuss what are the normal blood sugar level for a child. Let me discuss that first. This. So, what are the normal blood sugar levels in a child? Uh, what are the, if you have, please send in your questions and indicate where you're watching me from, please. So, what are the normal blood sugar levels in a child? Okay. By the time you suspect your child has type 1 diabetes, when you've gone through those symptoms that I've listed, and you suspect that your child has type 1 diabetes, okay, their blood sugar levels are likely well above normal, around 200 milligram per deciliter or higher. If a child has type 1 diabetes, their sugar level is much, much higher than in adults. It revolves around 200 milligram per deciliter or even higher than that. Okay. Now, a normal blood sugar levels for a person of any age, okay, of any age, a normal blood sugar level of any person of any age, even though it's a child, okay, or even a parent, even if you are 1 year old or 85 years old, okay, you still have to maintain same sugar level, okay, you still have to maintain same sugar level. But in terms of uh, when the sugar level is higher, it is much more higher in children in type 1 diabetes. It revolves around 200 milligrams per deciliter or even higher than that. And when it reaches that level, they have what is called an sharp increase in frequent urination, wetting the pants, wetting the bed, okay, ripers. So when it reaches that range. So fasting, so normal blood sugar levels for a person of any age. Remember, I said of a person of any age. Fasting blood sugar in the morning before eating is under 100 milligram per deciliter. Okay. Uh, normal sugar, normal sugar reading, normal sugar level of any person, of a person of any age, regardless of your age, whether you are a child or an adult. Okay. Before meal, fasting before meal, before you eat anything in the morning, your sugar level is supposed to be under 100 milligram per deciliter. Under 100 milligram per deciliter is what your sugar level is supposed to be. Okay, the sugar level is supposed to be okay. Let's excuse me. So normal sugar level for a person of any age. Remember the language of any age is fasting blood sugar levels in the morning before eating is under 100 milligram per deciliter. Okay. Now 1 hour after meal, 1 hour after meal, 1 hour after meal is 90 to 130 milligram per deciliter. Okay. Then 2 hours after meal, 2 hours after meal, 2 hours after meal is 90 to 110 milligram per deciliter. Okay. And then 5 or now 5 or more hours after eating is supposed to be 70 to 90 milligram per deciliter. Okay. So this is the normal sugar levels in a child. Now, this applies of any age. Of any age, your sugar levels, this is your normal sugar level reading. And as I said in the beginning, prior to this, a child that has type 1 diabetes, normally their sugar level is much, much higher than an adult. It revolves around 200 milligrams per deciliter or even more higher than that. And once it reaches that around that levels, there's a sharp increase in thirst to urinate more often, okay, when it reaches that level. So now, how do you test? We all know how to test our diabetes, okay? Even if not in emergency situation, you're at home, you know how to test for your sugar levels, all right? If you suspect your child may have type 1 diabetes, insist that they have healthcare. If you, after noticing these symptoms that I've just, after you spot these symptoms, and then you are convinced that your child has type 1 diabetes, okay, insist that your doctor draw a blood sample to measure blood sugar levels, okay? Uh, let's see what we're going to do here. I'm discussing testing for testing for type 1 diabetes in a child. Okay, and I said if it's not an emergency, okay, if you're not in an emergency situation, if you suspect your child have type 1 diabetes, if you suspect your child has type 1 diabetes, okay, insist that your healthcare, which is your doctor, draw a blood sample to measure blood sugar levels and collect urine samples to measure both glucose and ketones levels. Okay? You can only evaluate diabetics with your blood sugar levels and your urine samples. Okay? You cannot only evaluate only on one, it has to be both. So if you, after you spot these symptoms or signs that I said, and then you go to your doctor, as a parent, demand that your doctor draw a blood samples and a urine, okay, to measure the blood sugar levels and collect urine samples to measure both the glucose and the ketones in them. You might have to be very persistent because it is not all uncommon for doctors to miss the telltale signs of type 1 diabetes. If you're a child, let me say this to you guys. If you're a child, if you're a parent, if you're a parent or caregiver and have a child that has type 1 diabetes, the way you approach your doctor regarding your child is different from the way you are the patient. You got to separate both of them. If you are the patient, an adult, and you visit your doctor for an issue, your doctor has more say the way he or she will treat you on a particular issue. I want you guys to listen to it properly. If you are the patient, for instance, you are an adult, a parent, a father, an uncle, and then you approach your doctor that you are having some symptoms or you're having some health issues, your doctor has more say on how he or she treat your health issues. But if you are a parent or a caregiver and has a child that is sick, especially having type 1 diabetes, you have more leeway than the doctor because you have to be persistent. That doctor, I want this to be done to my child. Not in terms of prescription of drugs, but in terms of diagnosis. Some doctors will tell you, oh, no, it's okay, just no. But if you suspect that it is more than that, you persist. And as a doctor, you are bound to listen to the parent because he or she, the child there cannot verbalize, cannot talk because you are the one closer with the child 24/7. So the doctor have to listen to you as a parent, as a caregiver, and then do your bidding, but not in terms of prescription, but in terms of diagnosis. Okay, so even if it's not an emergency situation, and if you suspect that your child may have type 1 diabetes, insist that your doctor draw a blood samples, okay, to measure blood sugar levels and also collect a urine sample to measure both glucose and then ketone levels. Because you may have to be very persistent because it is not all uncommon for doctors to miss the telltale signs of type 1 diabetes. All right. So that is um, that is how you test. I wish I can. I wish this. Let's see if this can work. Get measure. I'm waiting for. And then two. I'm trying to make into. So that is how to test for type 1 diabetes in children, as I explained, okay, as I explained, if I'm still talking about testing for type 1 diabetes in children, in a child, okay? Uh, Let me see. So I'm still testing for type 1 diabetes in a child, okay? So what do you do? As I just explained, even if not an emergency situation, if you suspect your child may have type 1 diabetes, insist that their healthcare team draw a blood samples to measure blood sugar levels. That is one. And then two, collect a urine sample to measure both glucose and ketone levels. You may have to be very, very persistent because it is not all uncommon for doctors to miss the telltale sign, okay, for type 1 diabetes. All right. So now what happened? What happened if you are a parent and then you miss diagnosing your child for type 1 diabetes? What happened? Okay. What happened if you miss? Okay. What happened if you miss diagnosing your child for type 1 diabetes? What happened? Sherry, you're welcome. You're welcome, Sherry. And then Laura, you are also welcome. Welcome. You're welcome. So you're welcome. Both of you are welcome. So now we are talking about the tragedy of missed type 1 diabetes in a child. What happens if you mix diagnosing your child with type 1 diabetes? Okay. Now, you guys have mentioned about the symptoms, how to spot the symptoms in type 1 diabetes. I've mentioned it already. I've discussed it and I've pasted it already. And I've given you guys the three main symptoms to look at in a child. And I also give you guys additional symptoms to look at how to spot symptoms of type 1 diabetes in a child. Discussed that already. Now, since you've known those symptoms, all right, you've known those symptoms, and one thing you have to understand, a child cannot verbalize, a child cannot talk. They only exhibit what they're going through actions, either crying, destroying things, being moody, being isolated, rejecting food, the body temperature rises, or the skin tone pale. Okay, there are certain things that is where they express what they are going through because they cannot verbalize, they cannot talk. Now, if you miss, and I've said now we've just finished how to test. The last thing I just discussed was how to test for type 1 diabetes in a child. Now, what happens if you miss testing your child of type 1 diabetes? Okay. Sadly, every year there seems to be one or two deaths in the news of a child who present with signs and symptoms of type 1 diabetes but was sent home to test with a supposed about flu symptoms. I mentioned about it. I gave you guys three major how to spot a child with type 1 diabetes. And I did mention one is flu-like symptoms. If a child, let me just go back again. Okay. If a child has type 1 diabetes, that's why you have to have a good pediatrician. A good pediatrician will know how to treat a child with type 1 diabetes because mainly when you have a child, you have to do with pediatricians. They are the ones that are in that specific field in dealing with children sickness. So now, when a child has type 1 diabetes or juvenile diabetes, they start exhibiting like flu-like symptoms, like catarrh, they have running nose. If you're a child giver, if you're a caregiver or a parent and you see that your child all of a sudden develop a flu-like symptoms or a catarrh or a running nose, when it's not even the season to have a catarrh or running nose or cold, and you take that child to a doctor, some doctors will just overweigh, say, oh, just go home, it's a virus, just don't worry about it. Do not just ignore it. That flu-like symptom might be more than what it looked like. So many children have died because they misdiagnosing type 1 diabetes because you go to a doctor, they tell you, oh, it's a virus, a flu-like symptoms, nothing to worry about, and then you go home. And by the time you know, the child go into convulsion or into complications and then die. So, uh, so every year there seems to be one or two deaths in the news of a child who presented with the signs and symptoms of type 1 diabetes, but was sent home to rest with a supposed of a flu-like symptoms. Or he has a flu, so they send him home to have enough rest. Okay, and I've said, if you're a parent, don't just go home when they say go. Demand for a proper diagnosis of a child that's all of a sudden develop flu-like symptoms. Persist that I want a proper diagnosis. Take a blood, take a urine samples, check. Okay, testing for type 1 diabetes is easy, but it isn't tested for. It can result in a preventable tragedy. So when you see a child develop a flu-like symptoms, all of a sudden develop a flu-like symptoms, and you take him to your doctor and you say, oh no, the man be persistent that I need a proper diagnosis. Take a blood samples, measure for sugar levels, and also take a urine sample to measure for both glucose and ketones levels. It is your right because that child communicate with you through symbols or through actions. You are with your child 24/7. The doctor is not with you. So the doctor professional are bound to listen to you when you are persistent that I need a proper diagnosis with blood samples and urine samples. Okay, so uh, so that's why I say, as a parent, you must equip yourself with the knowledge about diabetes, how to monitor diabetes, how to test for diabetes, how to treat diabetes. If you are a parent or a caregiver, it is very vital that you have all those information to be able to render care to your child. Okay, so if you don't do a proper diagnosis, okay, if you don't do a proper diagnosis, then you are inviting tragedy. There might be some other complication that might arise that might end up in tragedy. So anything that seems to be true and not to be true, when you go to see your daughter with your child, persist that I need a proper diagnosis, draw a blood samples, urine samples, and test for, you know, glucose levels and ketones levels. They are very, very important because that child speaks through you. Cannot verbalize, they cannot talk. It's through the communication of actions that you see in them that is not there before that tells you something is wrong. So when you are, there's nothing give a child a comfort that you took him to a doctor and he's sitting beside you and you are communicating to a doctor what a child is passing through. So you have to be persistent with a proper diagnosis of that child. Okay? So it's very, very important not to miss type 1 diabetes in the children so that it doesn't lead to tragedy. Now, what causes type 1 diabetes in the children? Okay, what causes type 1 diabetes in children? We've discussed, um, let me go back a little bit because I did put this before. Okay, okay, so what causes type 1 diabetes? What causes type 1 diabetes in children? Okay, so, type 1 diabetes can occur in children of any age. There's no specific age for type 1 diabetes. Okay? Type 1 diabetes is related to autoimmune and it's genetic. And I've said it before, it's genetic. Okay? It is not entirely clear how the disease is passed down, and there are many other factors that are in play. Type 1 diabetes genetics is something you inherit from your parent or from your sibling. Okay? So that is why they are genetic. So type 1 diabetes does not run in families, and many newly diagnosed individuals already have a family member living with type 1 diabetes. Okay? If one parent has type 1 diabetes, a child has 5% chance of developing type 1 diabetes compared to a 40% chance in the case of type 2 diabetes. So if your parent, either of your parent has type 1 diabetes or your grandparent has type 1 diabetes, then your child stands a chance of 5% of getting the same type 1 diabetes and 40% chance of getting type 2 diabetes if either parent has type 2 diabetes. So the probability or the chances of you getting type 1 diabetes in a child when a parent has type 1 diabetes is less. Okay, so that is why it's genetic. It's something passed on from one generation to the other. So there are several genetic changes that can be tested for that to be known to be more common in individuals with type 1 diabetes. Okay, but many of these mutations or variation can be found in individuals without the disease too. So when it is genetic, it has to be due to mutations of the cells or the genes or the variations of the genes or the cells. Okay, so type 1 diabetes in a child is something that is passed on from parent to their child. That is why it's genetic. It's hereditary. It's in the DNA of the lineage of that family. That is how type 1 diabetes causes. In type 2 diabetes, it's about your lifestyle changes that can cause you to have type 2 diabetes. But in type 1 diabetes, it's something that has to do with genes and mutations and variations and something passed on from parent to the child. Okay. Also, there are other factors that might take into considerations in terms of the environmental triggers. We call them, we call them triggers like the flu or other serious illnesses, trauma in the form of death of a loved one or divorce, dietary inflammations. Okay, can also play a role in you having type 1 diabetes. But mainly, type 1 diabetes is something that is passed on from a parent to the child. That is why it's genetic. Okay. Now, let's go to So now let's be more specific. What happened after, now that you know, I've given you guys the symptoms, how to test, what to look out for, okay? Then what happens? What happens after your suspicion has been confirmed? Okay? After your suspicions has been confirmed, what happens next? After type 1 diabetes diagnosis, what happens next? Okay? So once you're now say, okay, it is confirmed that my child has type 1 diabetes, then what happens next? That is where the main problem starts. You are in a state of confusion because you don't know as a child. Maybe this is your first time to know something they call type 1 diabetes. You've never known anything about diabetes. You are confused, and you have a child that is 6 months old, 1 year old with that illness. The entire family lifestyle has changed forever. Once you're a parent and you have a child that is 1 year old, 2 years old, less than a year, and has type 1 diabetes, then that entire family lifestyle changes. Okay? Because all your life will revolve around that child to provide necessary care for that child. Okay? To provide necessary care for that child. Now, I've told you guys before in the beginning of how to care for the child with type 1 diabetes, okay? The core responsibility of a parent. I did listed it before. Let me go back and paste it again. I did listed what are the core responsibility. Okay, as a caregiver, where is it? As a caregiver, once now you've confirmed that your child has type 1 diabetes, and as I said before, that entire family life have changed. And as a parent or as a caregiver, you have a core responsibility. Now, and what are those responsibilities? Is testing of the blood sugar levels of that child persistently, constantly is very important. It is your core responsibility to test for the blood sugar levels and keep an adequate record. Remember, as I said, that child cannot verbalize, cannot talk. So you have to take blood testing sugar regularly, give insulin as when due required, eating regularly meals and snacks, also minding the carbs. We're going to go into that later. Balancing food and medication and physical activities, recognizing the signs of low and high blood sugar levels. Okay? Now, this is the core responsibility you as a parent or as a caregiver. And then the next thing again I said is about involving a child in a diabetes care and then talking to your child about diabetes. Okay? Now, once I'm going to come back to involving your child in diabetes care and talking to your child about diabetes. I'm going to come back to that again. Okay, but I just want to finish up this. After your suspicions have been confirmed that your child has diabetes, okay, what happens next? Every doctor has a different way of, or every pediatrician have a different way of treating a child that has type 1 diabetes. But most of the time, the first few visits after diagnosis will have the main focus being around support and education, as families are adjusting to life with a child with type 1 diabetes. So your child has type 1 diabetes, you've confirmed the suspicions. The first thing is get yourself equipped with the knowledge of diabetes. If a blind person cannot lead a blind person, the first thing as a caregiver, as a parent, is get yourself equipped with the knowledge about diabetes so that you're able to provide necessary care to that child. And then the support, you need a support for the entire family, because as I said, that entire family lifestyle have changed because all your life now will revolve around that particular child. So there's a total support from the family. And again, as a caregiver, as a parent, You must first of all equip yourself with the knowledge about diabetes. You have to know things about diabetes to be able to provide the necessary care given to that child. Remember, the entire life of that child, until the child becomes an adult, it's your core responsibility to provide that necessary care. Okay? You and your child should expect to be regularly taken through the following standards steps over the course of the first few weeks. So if you have a good pediatrician, a good doctor, family doctor that knows something about, or a good specialist endocrinologist that knows something about diabetes, in the first few weeks, there are certain steps that's going to be taken through. Okay, short hospital, short-term hospitalization. Okay, short-term. Uh, in the first few weeks, there are steps you have to pass through, and the first one is short-term hospitalization. Okay, if your child blood sugar levels are over 500 milligram per deciliter, remember I said at 200 milligram per deciliter, there's a sharp increase in the test and the severity of the child urinating frequently. With bedwetting the bed, the pants, the diapers, at 200 or above, the child constantly urinates. Okay, so at above 500 milligram, the first time, what after the child been diagnosed with diabetes, there are steps you have to pass through. There are steps. First of all, I've said equip yourself with the knowledge about diabetes, and then you need a total support from the family. And then the next thing comes after is the short-term hospitalization. There comes a time you and the child will be hospitalized. Why? Because if your child blood sugar levels are well above 500 milligram per deciliter, along with the high levels of ketones, we have high sugar level that is around 500 milligram per deciliter, and they will have high level of ketones in the urine. They will most likely be admitted to hospital for a few days to receive intravenous insulin or saline or lactate ringers, that is sodium chloride and sodium lactase, or potassium chloride and calcium chloride, to rebalance the blood sugar level, body blood glucose levels, and then electrolyte levels. That has to do with the ketone levels. So now your child has been, you know that the child has type 1 diabetes. You are equipping yourself with the knowledge of diabetes. You require a total support from the family. But there comes a time for you to be able to know what you are in, what the entire family is in, that is when you start experiencing short-term hospitalization. There comes a time you see that the sugar level has risen to about 500 milligram per deciliter. And at that level, both you and the child will be hospitalized. Because that body, okay, he has to receive intravenous insulin to bring down that sugar level. Okay, to bring down that sugar level. Okay, so in case you are lucky to catch your child type 1 diabetes early, when the blood sugar and ketone levels aren't as high as 500 milligram per liter, they will likely be sedated. They will be likely started on insulin therapy within a day or two of diagnosis at a scheduled appointment with a pediatric endocrinologist without needing to stay overnight in the hospital. That is why, as I said, if you have a child that has type 1 diabetes, you, you have to be constantly monitoring the sugar level not to get to that stage of 500 milligram per deciliter. Because at that stage, you and the child will be in the hospital. But if you're able to catch it early, when it's around 200 milligram per deciliter, then you don't need to be in the hospital. Okay, other treatment can apply. Now, after short-term hospitalization, because while you're in the hospital, you will learn a lot. Also, while you're in the hospital with the child, you start what is called starting insulin therapy. Okay, a person with type 1 diabetes, your child will need to begin insulin therapy immediately to bring their blood sugar levels down to a safe, healthy range. So, because all that time you're in the hospital admitted with the child, you've been educated or learned how to provide insulin therapy to that child while at home, so that the occurrence of that you won't be rushed back to the hospital to be hospitalized for the second time or to the third time, because now you know, okay, at this level, I have to spend some days in the hospital. So it is your responsibility when discharged and you're at home, you know how to provide insulin therapy to that child to stabilize the sugar level to be below 200 milligram per deciliter and not above 200 milligram per deciliter. Okay, so the second step you have to pass through as a parent, as a caregiver, that has a child with type 1 diabetes after short-term hospitalization is starting insulin therapy. Okay, as a person with type 1 diabetes or a child with type 1 diabetes, you need to begin insulin therapy immediately to bring their sugar levels down to a safe and healthy range. Because people with type 1 diabetes need about 24/7 of rest of their life in order to survive. So that's what I'm saying. If you have a child at that age, less than a year, 6 months, 1 year, 2 years, already type 1 diabetes, for the rest of their life, they have to be insulin dependent. Okay? They have to be insulin dependent. So we've talked about short-term hospitalization and we're talking about starting insulin therapy. Okay, and then there are two ways you can administer insulin. It's either through injection or through pump, POD. Okay, there are two ways you can inject or you can apply insulin. It's either through pump or through injection. Through pump is pump or POD. Okay, a small device attached to the body gives continuous feed of background insulin, and with the push of a button, you or your child can administer additional insulin to cover the food or bring down the high sugar levels in the bloodstream. Okay, the injection insulin is a pen or a syringe. This method requires a long-acting background insulin or fast rapid-acting insulin of males to correct the sugar levels in the bloodstream. So there are two ways: it's either through injection or through the pump or the POD. So these are some of the steps you have to pass through to familiar yourself uh, with your child's situation. And I've taught you guys about daily monitoring of the blood glucose levels. It is your core responsibility as a caregiver to make sure you monitor your child uh, blood sugar levels. Okay, and then counting the carbohydrate. Okay, counting the carbohydrate is also very important. Counting the carbohydrate is very, very important. Okay, dosing insulin every meal depends largely on what you eat. Fortunately, today's insulin provides people with type 1 diabetes the ability to mostly eat what and when they want. But this freedom comes with responsibility of dosing insulin carefully. Okay, your doctor is going to help you to identify what carbs to take, amount of carbs to take, and then immediate action to be taken when dieting on low carb. As a child, if you have a good pediatrician, you're going to be advised to stay against low carbing. Low carbing for a child is not good. In adult, yes, but in the child, low carbohydrate foods that consistently all the time, or even once, it is not good. So your doctor is going to advise you type of carb, what amount of carb, and what amount of food to take. But low carbing in children are not advisable. Okay, so in terms of counting your carbs, your doctor is going to advise you. Okay, but one thing you have to understand: low carbohydrate, or that we call it low carbon, it is not advisable in children with type 1 diabetes. In adults, yes, but in children, it's against. And I'm going to tell you the reason why a child with type 1 diabetes should not be dieting on low carbohydrates. Okay, we're going to go into that in a little while. Okay, now let me go back to what I was talking before. Now, involving a child in a diabetes care. Okay, I was talking before. I just mentioned what the core responsibility of a caregiver to a child with type 1 diabetes, a parent, and I did list all the responsibility you have as a parent or as a caregiver to a child that has type 1 diabetes. Now, and I was the next one was involving a child in diabetes care. Now, in this aspect, and I did says encourage your child to be involved in their diabetes care right from the start. Identify reasonable tasks that your child can do for themselves, even if they are so young. Okay. Now, as they become independent, children can take a larger role in their diabetes care with the support from their parent. Now, and I said again, involving what I said, talking to your child about diabetes. Talking to your child about diabetes is very important. When they start verbalizing, when they start talking, then you got to bring them in gradually and talk to them about diabetes. Okay? The way you talk to your child about diabetes will have a big impact on how they perceive the diabetic situation and themselves. Okay? Being positive and supportive will help boost your child's self-esteem. Now, when speaking to your child about diabetes, one, discuss how food fit into a healthy lifestyle. Okay? One, discuss how food fit into a healthy lifestyle. And number two, describe the blood sugar levels as in target, high and low, high or low. You have to be specific when discussing with your child. Describe the blood sugar levels as in target, high or low. All right. And then the thirdly, talk to your child about the important things that are happening in their life, such as schools, sport, and social events. All right. And then number four, remember that diabetes is only one part of their life, of your child's lifestyle. Life. Diabetes is only one aspect of your child's life. So try not to describe food as bad or junk, and avoid describing blood sugar levels as good or bad. Okay, so now let me see something here. Um, let me see what I can put here. I'm going to put it in the comment section here. Uh, to describe talk to you. And then for remember. So as a caregiver, I did mention something here. Okay, so now um, involving other caregivers. This is where you guys have to listen properly. Those that have children, I'm going to talk in general, involving other caregivers. Okay, involving other caregivers. So let me remove this, and let me remove this. I think I'll finish with this one. All right, involving other caregivers. Okay, it is important that other caregivers understand the child diabetes situation. If you have a child, you guys have to be very, very careful in this section I want to discuss, involving other caregivers to look after your child that is type 1 diabetes. Okay? It is important that other caregivers understand your child diabetic status and know how to take care of them. And then members of your child care diabetics team can provide educational seminars or details to other caregivers. And what am I saying at this point? Why am I saying this? Involving other caregivers. If you have a child that is type 1 diabetes, that child must go to school, right? Okay. Not every school is equipped to handle children with type 1 diabetes. So if you have a child that has type 1 diabetes, you have two options to do. You have to look for schools that have that are equipped with facilities that caters for the children that have diabetics. Because you have to be at work. That child is diabetic. You cannot just go and put your child in any school and he or she is diabetic. No. If you are a parent that has type 1 that has a child with type 1 diabetes, you must equip, you must find your child the school that is equipped or have the knowledge of handling children with type 1 diabetes. So that in case of an emergency, the blood sugar is too low or too high, or they exhibit some symptoms, the school already know how to manage it while you are at work or at home. And then you must let the school know your child diabetic status. Because those schools that have the facility to manage children with type 1 diabetes also knows they know they are equipped with everything in terms of both checking their blood sugar levels, their foods, their exercise. They know it's not only teaching them, giving them the education they need. They are also equipped in terms of emergency, what to do and what not to do, time to check their blood sugar levels, what type of food to eat, because those schools are there, but they are very expensive. Not everyone can afford it. Now, if you know you cannot afford it, or there is no school that are equipped to handle children with type 1 diabetes, then if you must enroll your child in any particular school, there are two things you got to take into consideration. If you cannot afford those schools that are equipped to take children with type 1 diabetes, then you can also enroll your child in any school that does not have those facilities to handle children with type 1 diabetes. But there are two things you have to fulfill. One, when enrolling your child in that school, you must let the school principal or the teachers know that my child is a diabetic. And then you go to also educate the school or the principal or the teacher that this is what to do, this is what to do when this happen. Or should this happen, please give me a call immediately for me to rush down here. You must be closer to the school to respond immediately. But once you are enrolling your child to that particular school, you must let the school principal know that my child is diabetic. These are the things you have to do when this occur. When this occur, this is when the food, everything is in the bag, because that bag that your child goes to go to school must all the testing material must be there. The food he has to eat for that particular day must be there. So you also have to let the school know at this time, this is what my child is going to eat is in the bag. At this time, this one is going to eat. At this time, this one is going to eat. So the school already know that okay, the child comes to school with the food, okay, and the school knows that the child is diabetic, and they know okay, they're going to test the sugar levels. So you got to let the school know. That is why they call it. That's why you say involving other caregivers. First of all, the school must know. You must educate the school. You must let the school know that your child is diabetic. And if the school agree to take such responsibilities to look after your child while you are at work at home, fine. If not, look for a school that has a clinic or hospital just about 2 or 5 minutes away. There must be a clinic within that school area, not less than 5 minutes away. So if any emergency, they can rush the child to the school clinic immediately without wasting any time, pending when the parent arrives. So make sure you look for a school that is closer to a hospital, not more than 5 minutes walk away or 10 minutes, maximum 10 minutes. There must be a clinic or a hospital around that school. So should there be any emergency, the school can rush down to the hospital pending your arrival, and then they can start taking care of that child. But already the school has been notified that your child is a diabetic. So when they get to the hospital, they can tell this hospital, this child is diabetic, the parent is on the way. But at least help is already being taken for the child. So that is what I'm involving other caregivers. And if you have a child that is type 1 diabetes, the same thing applies when you are leaving home. Make sure you are with the child at all times and make sure you know how to boost the sugar level up and bring it down when such occurs. That's why I say it's a lifetime management. So it is important, okay, that other caregivers understand your child diabetes and know how to care for them. Okay, and members of your child diabetes care team can provide education to others. So if you inform the principal that my child is diabetic and you educate them, let them know the things to do and what to watch out, then the principal is now going to educate other teachers in the school that we have a diabetic child here. Should there be an emergency, this is what we are going to do. And the food and everything is already here. So the school know what to do, what kind of food, and what time to feed that child. Okay, so always provide the caregiver and school personnel with. So I'm going to post. Okay, let me. I don't know how I'm going to do this. I don't know how I'm going to put this here now. Um, I'm going to put okay. Let's see. I'm trying to do something here. I'm waiting for questions. Nobody's asking me questions. 30. Do you have any question? I'm trying to post this for you guys to read. All right. So we're talking other caregivers, right? So involving other caregivers. So I've told you guys always provide other caregivers and school personnel with. Okay, let me put this here for you guys to understand what I'm talking about. Let me go to the banners. Okay, so I was talking about involving other caregivers. It is important that other caregivers understand your child diabetes and know how to care for them. Members of your child care diabetes care team can provide education to others. Okay, now when always provide other caregiver and school personnel, there's certain information you have to provide to them. All right, there's certain information you have to provide to them. Now, always let me go to this. All right, let me put this for you guys to males and then pre-treatment. Treatment again. And then contact information. All right, I just posted. I just posted. So always provide other caregivers and school personnel with this following information: schedules of blood sugar testing, times and insulin requirements. 2, meal and snacks plan. 3, treatment plans for low blood sugar. 4, treatment plans for high blood sugar. And then 5, contact information for emergency situations. So once you are dropping your child in the school, you are enrolling them in the school, you have to provide them with all this information each day. They know what to do in your absence. That is why you are involving other caregivers. Okay? So it's important you provide them with those information. Okay? So once you know that, and then let's go back on the let's go back and finish up the remaining things now. All right. So once I'm expecting a question, nobody's asking me a question. All right. So now I've given you guys all the information you need. So at least you guys, any parent that has a child with type 1 diabetes, at least with this information, will be able to know how to uh, go about it. I think I'm left with treatment. Okay. Uh, yeah, I was saying something about low carb. Okay. If you have a child that has type 1 diabetes, you have to avoid low carb diet. Okay. In adult, it's different, but in a child, low carb are advised against. Your pediatrician will advise you against low carbing instead of because low carb can harm the kid natural growth and development and should only be done under professional supervision. Instead of low carb diet, they recommend that children who need help managing weight or glucose level limit carbohydrate from sugars, processed food, and sugar sweetened beverages. Okay. Now, low carb and ketogenic diet are popular among many people, especially in adults. Okay. However, doctors have advised parents should avoid this diet for children with type 1 diabetes. Okay. Avoid it. Low carb is not advisable for children who have type 1 diabetes. In adult, it's different. Okay. While low carb diet can benefit adult, there is a little uh, difference in terms of children. Okay. There's a little differences in terms of children. Uh, so low carbon for children is not advisable. And okay, uh, it's more, it's going to affect child growth acceleration, nutrition deficiencies, hormone health, nutritional criticizes that cannot be distinguished from criticizes resulting from insulin deficiency, or and again disordered eating behaviors. So that is why it's advised when you have a child with type 1 diabetes, low carbon is advised against. Your pediatrician who's going to advise you. For adults, if in adult is different. You are expected to low carb, but in children, low carb is totally advised against. Instead, okay, if you have a child that has type 1 diabetes, you're going to manage and has issues in terms of weight or glucose level. All you have to do is to limit the carbohydrate intake from sugar, processed foods, and sugar sweetened beverages. You know, children like sweet things. So Coke, Fanta, cake, all the time you go to fast food joint, they like sweet. So you got to limit the intake of carbohydrate intake. You got to reduce it drastically and start at the tendency of that childhood. When they are that little, start treating your child. Avoid giving them a lot of sugary items, Coke, Fanta, ice creams. Stop. By the time they start growing up into their teens, you know, adolescents, in adult age, they'll be used to not liking sugary items. So that is why you got to limit the carbohydrate intake from sugary or processed foods, okay, or sugar sweetened beverages. But low carbon for children is advised if they have is advised against for children with type 1 diabetes. In adult, yes, you have to low carb. But in children, you cannot low carb in children in terms of carbohydrate intake. So those are the things you have to be aware of. Can we get have more 10 minutes to go? Have more 10 minutes to go. Do we have any question? All right. So if we don't have any question, okay, then I'm going to leave it to you guys. At least I'll provide you guys enough information you guys need. And then I'm going to see you guys this evening for the fan forum. So if no question, and if this is your first time coming across my page, please do not forget to subscribe to my page. If this is your first time coming across my page, do not forget to subscribe to my page. Okay? Follow me. It costs you nothing not to follow me, and then give me a thumbs up. If you like this video, give me a thumbs up, share and comment, and also follow me if this is your first time coming across my page. All right, I'm on Facebook, I'm on YouTube, I'm on Instagram. So if you have any question, then you guys can send in your question later, and then I could answer it at my own time. But this is the end of today's program on kids and type 1 diabetes. I believe I've given you guys some information that you guys need. All right. So any other further questions, please feel free to send in your questions or comment later and I'll respond. So now I'm going to leave you guys and I'm going to see you guys today later on the fan forum section where I do answer questions. So I'm going to see you guys later this evening on the fan forum questions. Okay. So follow me, subscribe to my page, and then if you like this video, give me a thumbs up. All right. So I'm going to see you guys later today. Thank you and goodbye.